We've been going for about 2 years, trying to make a creative place for research where people feel comfortable. Because often research goes up onto some kind of pedestal and gets lost, or we move into an attachment to the academic or the over-numeric, and if Sesame's guilty of anything, it's not going there. But there's a kind of preciousness that we can lose from the way that we work as we struggle to join numbers with image and symbol in the ways that drama therapy work. So we take 15 minutes at the beginning of each of these just to try and make a user-friendly space that makes us ordinary and makes us drama therapists before we're researchers. So it's coming from a place of collaboration. That's a good research word, collaborative research. I think it's quite a hard word to get to. I think we're so used to being in competition that we can often go straight for the da-da-da-da-da and forget about collaboration. So I'm just going to take a minute, and what I'd like you to do is to, see everyone's got pens and papers out. So I'd like us to play for a moment with the person next to us who has 1.5 minutes to tell about their research that they are doing or which brings them here boastfully. You're really, really proud of it. And the person who's listening is to listen with a sense of really believing the boast. You're going to value everything that is said to you. And then we'll whiz it round, and I really urge you to stay with what you're talking about, but be playful with it. Your motivation is boastfulness, and you're going to boast about the research you do. Then we're going to whiz it that round, do it the opposite way, and then we'll do that introducing our partner, get their name first, introducing this piece of research or writing or curiosity or questioning that they're doing and giving it value. Clear enough? Mm-hmm. Okay, so choose as you like. I'm timing you. And this is Laura Downing, who has pulled a crowd, and it really is a gas, and a very warm welcome. You've got as long as you like. At some point we'll have a tea break, and there'll be Q&A if we have it, but the time is yours. So.
Fantastic. I feel terribly intimidated with brilliant around me. But I'm hoping, I'm hoping by the end of this evening, you will be able to use gas. Completely, absolutely, without, it might take a little while, but you will know what you need to do, and we're actually going to do some experiential writing stuff, thinking about it. Sorry, I have to keep running back. No, it's slightly wonky. So gas, goal, attainment, scoring. I sometimes say scaling. I've seen it scaling in some places. Gas. Okay. A little bit of a background. I've been working 14 years as a drama therapist, nearly always in forensics, if I'm honest. I have kind of, one of those forensic people that once you get there, you kind of stay with forensics. But I have used this with learning disabilities in forensics, and lots of other mental health. So I've used it, I piloted it last year, and I'm currently doing some stuff with Roanna. So we know exactly what the pitfalls are. I hope it won't be too dry and sort of heady, I suppose. Just listening to what Mary was saying in the introduction, I was thinking it does feel very different for me to be coming here and sort of talking about something that's sort of boxes and tick boxes, which I have to be honest, I've always been so anti in the past. It doesn't sit very comfortably with me when I think about the nature, the playfulness, if you like, of our work, or the imaginative nature of our work. And I'm wondering if that's why I suppose that we kind of resist it. And we really do resist it. There's all sorts of things. I mean, people have been talking about it, well, certainly since I trained to be a dramatherapist 14 years ago, and we still haven't quite got it, I feel. Before I rant on anymore, I will rant a little bit about this, but what I want us to do is to think about evaluation, and I picked green for the positive thing and pink for the negative thing. I don't know if that's, you can swap them around if you want. What I'd like you to do is write down, only small, maybe a word, things that you think maybe are good about evaluation and things that you think are bad or you don't like. Or, you know, you might want to write boring. That's a word that certainly springs to my mind. So if you just, we're going to do this fairly quickly, and then we're going to put them on the evaluation sheet and see what we've got. Probably. So if you could, yes, if we can just, so you should have one each. See, look, this is my I did have to swear I did before I took that out, but yeah, why bother?
Yeah.
Isn't what we do enough? What about our golden moments? Why can't people tell? I said green for, I suppose I was thinking of growth, green, and I was thinking of a leaf falling off, something with pink. Yeah. So just quickly thinking about a word, and then what I think we'll do, is this going to work? I'm sticking. I kind of think it's nice if you don't have to read your own out, and then you can say really what you really want to say. Does that make sense? So I was going to put them in a cup, and then we get other people to pick them out. Has everyone got something? Let's mix them up. All right. So just say out loud, and has everyone put theirs in? Anything that comes up.
This one says proving theory.
And that's on a pink one. So are we thinking that's a negative, maybe? Do we have to prove theory?
That's quite positive.
I think it's positive. Okay. Yeah, it could be either, which will be the point of this exercise. Necessary and needed. Up here.
I don't know where to place this one.
Well, I was thinking of leaves.
Okay.
That was the idea, but at the end we have a bush. The vision may not be, I haven't actually done it before, so you know.
It's a negative one. I think we'll have to forget the colour coordination. This was restrictive.
Okay. Interesting. Unmeasurable context of work.
Do you want them all on the branches?
Yeah, well, we don't have to.
Okay. Interesting, question mark, for funding.
Supportive.
Knowledge, shared knowledge.
Scientific validity.
Accountability and measures goals. Measuring success, in inverted commas.
Hard to find something quantitative with drama therapy.
Understanding.
Time consuming.
Restricting.
Can be reductionist.
Look, it works. See this.
Measuring failure on whose terms? Interesting.
Jumping through bureaucratic hoops.
Opens doors.
Certainty.
Grinding labour. Lie down.
What if it doesn't work?
Yes. Numbers. Often. Yuck. Numbers.
I think that's exactly what it says. Numbers often yuck.
Yeah, numbers. A way of learning and responding to work. Just rushing through a few.
Misleading.
Possibly. Educational.
Enabling and demonstrative. Allows us to get funded and keep on working.
It's easy to abuse.
Reductive.
Twice we've had that, but that's interesting, it's come out twice. Funding and recognition.
Shows benefits to others.
That was the last one, I believe. That was a good one to end on. Okay, so that's giving us a bit of a flavour of the thoughts that just in this room we can imagine across all the arts therapists, but in particular, I think I would say the drama therapists, from my experience, the kind of feeling about why should we have to evaluate what we're doing? How can we evaluate what we're doing? I mean, that comes up a lot when people are speaking about maybe their work or describing their work and speaking about, you know, our golden moments that we refer to. How can we evaluate that? And I suppose what I'm going to say, I don't know if we can, really, other than really capture what happens in the room in a way that I think we understand as practitioners. However, we can still evaluate, we can still do it. GAS is a number crunching exercise, but what I like about it is you can tailor it completely to the individual. You can absolutely do what you like with it, to be honest. You are setting a goal, but you're looking at all the little steps in between, so you can measure a very slight change. And you can really look at things that would be important to us as drama therapists. So we don't have to get stuck in an educational model or in a behavioural, you know, is someone behaving themselves? I think about that obviously in forensics, that's often what's being measured on the ward. We can look at things that we're interested in. I'm not going to lie to you, it might appear quite complicated when I do it today. I'm going to try and make it simple. But the reason I've given you all handouts, and we're going to have a practice at doing it as well, is to really, once you've got it, it's pretty straightforward. But at the beginning it can seem, I found it a bit tricky, but then I'm not very good with numbers and things like that, and I tend to think that's not my thing. So the fact that I'm standing here doing this means that, you know, it must have something. Should we turn the light out? Is that all right? So that we can see it a bit better. Okay. Some of this information has come from this thrilling book, Goal Attainment Scaling, Applications Theory and Measurement. It cost £60. I got into so much trouble when I asked the director of psychological therapies to pay for it. But I'm sharing it across all the departments, but it's really me that used it. GAS was originally developed for use in psychotherapy. Another reason why I like it. It's not an educational tool or psychology tool that we are stealing. It tends to be used by occupational therapists. That's when I've come across it before. But the fact that it's very adaptable, flexible, etc., individualised, means it can work for psychotherapy. Do you want me to read all these things? I will read them now. So, and this comes from Lewis. These are potential therapeutic benefits that might be anticipated from the use of GAS in mental health treatment. Improvement of the therapist's conceptual basis and organisation of treatment efforts. I mean, basically saying we know why we're going in to work with somebody. We know what our overall aim is. Which we mainly do, don't we, when we go in to work with people. It may change over time. So improve clarity of treatment objectives for both therapists and patients. They're called patients here. It's because I work in an NHS hospital. Please, if you normally use the word client or whatever word you use to substitute it. Facilitation of patients' problem-solving efforts. That's in you're actually involving the person you work with where possible. It's not something you're deciding at a desk saying, you need to do this. Where possible, you can actually sit with somebody and say, what would you like to get from this? Or what do you think you're going to get from coming to drama therapy? Establishment of realistic patient and therapist expectations of therapy, and I think that's another important thing, is, you know, slow steps quite often for people. We're not going to change the world in 5 sessions, much as, again, working in NHS, you know, they have this idea, 10 sessions, they'll all be fine, you know. No, actually, it might be the beginning, we might find out what we need to do afterwards. But again, you are setting the goals here, so you can set them accordingly. Increased patient satisfaction, increased therapy goal direction, increased staff and patient agreement and cooperation, increased motivation of the patient towards improvement, provided by the existence of the goals, so just knowing they're there. Improved therapy outcomes, i.e. increased goal attainments. Next. So when it's used for clinical rather than for research purposes, the outcome score provides an indication of the accuracy or realism with which the treatment goals have been chosen. What it shows, actually, and you'll see this when we put it into practice, is if you choose goals that are unrealistic, the score you're going to get, if you get this ridiculously high score, it basically means you've either chosen something that's too easy, or if the score is really off, it means you've overestimated maybe somebody's abilities or what they're going to do. And you can revisit it and look at it again. So it's not a failure as such, but just being very realistic about what can be achieved or what might want to be worked on. So when you're looking at the results, you can kind of do that as part of the therapy. So we're going to, we're on to here, yeah. So basically, you're measuring achievement of treatment or intervention goals. So you're thinking, I'm going in to offer drama therapy for how many weeks initially. What are we hoping to achieve by the end? Okay? So by the end of this first stage of treatment, if you're in long-term therapy with somebody, you can do this, say, every 3 months if you want to. And then you don't measure every session. You don't have to measure every session. You can measure over a period of time. I think you're more likely to get a more accurate idea over a longer period of time, but you can measure it for short term as well. It can be used, again, sorry, some of this wording is sort of forensic, it can be used with service users with different kinds of treatment issues. For us, that means that people who have, mainly have people who have schizophrenia, but quite often personality disorder, both substance misuse, a variety, really, of different diagnoses. And if you include the person you're working with, it makes it, you know, certainly with the idea of sort of people feeling suspicious about what you're doing, it can open it up a little bit. Can be used with service users with different numbers of treatment goals. So you can do, I tend to do 3 goals. They say you can do up to 8. I think you'd probably be mad, actually, to do 8 goals, because it'd be an awful lot of work. But it does mean you could look on an individual if you wanted to do that many. You could look at all these different aspects for them. And you can produce a goal attainment score, which allows you to track progress. Now, talking about extra work, this is a thing that I have put in, which you don't have to do, so it's extra work. And the reason I've put it in a glossary of interventions, basically saying what I do, the sort of things I do in a session. Now, the reason I've done it is because I'm not the only drama therapist at the moment, because I've got Roanna with me. But actually, you know, I cover, I think it's 9 wards, and people don't really know what I do. And I do feel like it's down to me a bit. They've got all kinds of ideas about what I do, and I've been there for nearly 8 years. I think they still think I'm going to put a show on at Christmas, really. And sometimes I don't correct them because I haven't got time on. So what I've done here, actually, if you go to the next one, I don't expect you to read with us, but this is what I've done, and I've given you these. These are all things that you may use. But what I've put in is things that I kind of look at. I look at whether people turn up each week, and if they don't, why don't they? Has something happened the week before? Has something happened on the ward? Is it a certain time of year when they're less likely to come out of their room because it might be an anniversary of something? All those things. So attendance I'm looking at, group contract, emotions thermometer. I don't know if other people use this, you know, this idea of how you're feeling, so check-in. Sound and movement of how you're feeling, that old chestnut. Very popular. Yes, I still use it, actually, because it works. Pack one, mindfulness. Mindfulness is a bit of a buzzword at the moment in the NHS, so I'm just doing whatever I did before, really calling it mindfulness. But you know, the idea of creating a space. Aren't we all doing that? It's the same sort of thing, really, isn't it? We're allowing some time for a space to get on with the work. Beanbags, do beanbags with names. These are, yeah, these are all things shared, but I've put them in a numbered glossary. It took a little while, it didn't take that long. A couple of hours, maybe, not even that. And the reason I've done it is because then I can refer back and say, I was looking for this goal in using exercise 3, 5 and 7. So if someone's really interested, they can think, oh, actually, I can see that they're using this particular one to do this. So the reason I've done it, and you don't have to do it, in fact, click the next one, I think. So story enactment, grounding, reflection, improvisation, next one. Yeah, art. But you don't have to do this. So it's an extra one. You do only need to do it once, because I put in everything that I might use. So if I suddenly have a new, different type of exercise, I can just stick it on the end there. I do think it demystifies for other people when you're working in a service what we do. I mean, it doesn't completely, does it? Because there's still here the sounds going behind the door. It's a wonder probably what we're actually doing in there. But it just... it gives the evaluation a bit more meaning, particularly if someone's looking at it and you're not there to explain what you've done. Someone can look at it, you know, it's been on the desk of some directors. I don't know how much attention they paid to it, they said it was great. But, you know, if they wanted to, they could look and see, oh, this is what she does to look at this or to explore this with somebody. Okay, so an extra bit of work. You have got those ones, you know, you can just take the ones I've got and adapt them and probably write them better than I did, if you want to, but I think it's useful to have. Okay, where are we? Goal area selection. First step involves selecting high priority goal areas. So what you're going to think about is, exactly what I was saying before, why is this person coming to drama therapy? It might be if you get referrals, somebody said, I think drama therapy would be great for this person because they need to express themselves non-verbally or something. Now you don't have to agree with that, but you know, you can work out what you think that person is going to be getting from coming to the drama therapy. And ideally, and we've managed to do this, if we actually go and sit with somebody and say, well, why would you like to come? What do you think is going to happen? Now, sometimes they might say, well, I want to come because I like acting. I mean, that happens quite often, actually. I think that's great, fantastic. And what do you think? What do you think knowing about acting is going to do? And sometimes they say, well, I think, you know, when I'm in my ward rounds, I'll know how to deal with people, and I'll be able to, you know, I won't feel so nervous. And so then we're getting into self-esteem, confidence, all these sort of things. Do you see what I mean? So we can translate a goal with somebody, and you know, and see if something fits, so that you're both in agreement for it. Sometimes with people, so when I worked on the LD ward, I didn't go through all of the goals because it just wouldn't. It would have been too complicated. Actually, it would have been too difficult. But what I did do was. I might be saying this later on, but I'm saying it now, is particularly with somebody I work with who, somebody who's autistic, that I was working with the speech and language therapist as well. So we were looking at things like when we were looking at identifying emotions, we took 3 to start with, you know, because it needed to be that simple, and looking at the same 3, and we actually worked separately but at the same time on the same goal. And I think that made for, you know, added clarity for the patient involved. You know, he really progressed and he seemed to not be flustered by it, which he often could be. And I think because there was some linking in with other members of the team. You know, it does depend, but if you can do that, I find that people tend to respond quite well to thinking, you've got this sort of this goal in mind. So what you're thinking about is the issues that will be the focus of treatment. Now what's good here is there might be loads and loads of things. And you know, there's some that might be mental health problems and some that might be just things that are difficult in their life. If for example, I had with somebody who kept asking to go to the toilet, 5, 6 times, and you know, because it's a lot, for instance, we've got alarms, someone has to stay in the room and there has to be a certain ratio, and then I have to get them to the toilet and then get them back. And obviously it was probably to do with something else, as in where there was a bit of a hand washing thing going on, but also I need to get out the room and come back in, I need to get out the room and come back in the room. You know, so we could actually look at that, measuring as an idea of how long can this person stay in the room, actually, or can we reduce the number of times they're going to need to wash their hands or go to the toilet. So you can use something quite concrete like that, or you can also, let's see what the next one is, think about things like self-esteem. We talked about internal world, and you could use anything really. We could look at authenticity in what they're showing, or how do they maybe speak about their internal world or convey their internal world in a way that is people are listening to it, or is not acceptable. I'm trying to think of the right word, but you know what I mean, you can look at anything. And what we're going to do now is, I've got so much, I'm going to run over terribly, but this is an important bit. I'm going to put them on. If you go to the next page, there is a blank one of these. Oh, sorry, just do another, it's going to do a whooshing. I know. You've got one of these. Now, what I'd like you to do is to think of somebody that you either have worked with or you are working with now. Has everybody got somebody that they have worked with using drama therapy? Yeah. I kind of made that assumption. So, maybe put the lines in actually, yeah. So what I'd like you to think about in goal 1, 2 and 3, it doesn't matter if you get it wrong because we're practicing, okay, but think about 3 goals that you might have with a particular person that you've got in mind. So if it's easy to pick someone you've worked with in the past, they're clearer, then do that, because it's just going to be an example. So goal 1, goal 2, goal 3. Just bear in mind, it needs to be something we can measure in some way. So if we're going to say increase self-esteem, we're going to be then thinking about, how do we know their self-esteem is increased? Because we've got to look at things we're going to assess. Okay, actually just for time, if you've already got your goals, what I'd like you to do is think about what you're going to be looking for to measure those goals. And in the 0, you're thinking about at the end of your treatment, or at the end of the amount of time you're measuring, where do you expect that person to be? So if they're using the toilet 5 times in a session at the moment, do we realistically think we might be able to do it twice by the end of the session, as in the beginning and the middle, adhering to those boundaries? Or do we think that actually they're probably still going to be, you know, 3 there. So be realistic in what you think they're going to achieve by the end of the time that you're measuring. Does everybody have set times when you start working with people, or is it just... So that again, that might be, I don't really, but I tend to sort of divide things up into terms, only because I've got children and I tend to have breaks at that time. So it's a time when you can sort of think halfway, half term, end of term, as a measuring point, even if you carry on working. Because it doesn't have to end at that time, it just means when you might be doing your score. So some ones I've picked: focus in group activities, ability to share with others in the group, and the last one, ability to recognise and differentiate between different emotions, which sounds vast, doesn't it, actually? So we'll have to bring that down. And I have to say, this is, I think, the most difficult bit about GAS, by the way. The scoring bit's, yeah, it's not like that at all. It's actually getting our heads round, you know, thinking about the right words when it's not something we're maybe used to doing. Once you've got it, for a start, you'll find similar ones come up. But also, yeah, you'll get into the swing of it and it'll be hopefully much easier. So an indicator for the goal is we're looking at, a bit like, if we're saying increased self-esteem, how do we know? How do we know? Because somebody, when they seem more confident, may offer more to the group, or they may be able to wait their turn. So thinking about what we notice about this individual that we think is indicating that they need to, or they would benefit from some increased self-esteem. So looking at the behaviour, if you like, the indicators that show us this. So we're thinking about the end of treatment. That's really important. The 0 needs to be what you think, both of you together, you're going to achieve by the end of treatment. So yeah, if we just go on to the next one. Sorry about that. So, for this one, for these people, I probably had somebody in mind here, I can't remember now when I wrote this. So, able to focus on some group activities with prompting from facilitator, the focus one. So, some group activities, not all of them, with prompting from facilitator. Can you see how that is going to allow me to do when I fill in the other ones? So ability to share with others in the group. Ability to share with others in the group some of the time with prompting from facilitators. So again, it's looking, does someone need to be picked up on something or need assistance, as in, you know, how does it feel not to go first today or something, or asking them to contribute, or are they volunteering a contribution? And last one, able to recognise, differentiate between 3 emotions, and that's one where you can bring a number in. 3 emotions, 2 emotions, 1 emotion. So, just having a look on one of your goals, pick the one that you feel like you could do. Just see if you can, for one thing, make sure you've got your 0, and just have a practice seeing if you can get -1 and -2. Just to explain what these are, these different ones. -2 is the worst case scenario. No, when it, you know, everything goes really wrong, the worst thing can go. So never listens, constantly bites hands. What was your one again? Violent outbursts. So it's secluded, unable to come to sessions. Violent outbursts all the time, uncontainable. This is the worst case scenario. -1 is something in between the 0 and -2. +2, the best that you feel can be achieved, actually, with this goal. So, you know, focusing all the time on all the group activities without any prompting from the facilitator. Sometimes that will happen in one session, actually. It might not stay there, but you will see that. I mean, certainly when you start, one thing I think is difficult, it's quite difficult to think about goals before you know somebody, I think. And I know, if I'm honest, I've written goals and then I've changed them afterwards and filled them in. Because actually I've thought, actually, no, that's not what's really he's bringing to the session. What he's really bringing every single session is this. And to go back and change it. I could do that because I tend to work on my own when I've been with Rowan. Sometimes we are looking back at things. So I think, you know, certainly when you start, do allow yourself to do that. I think it's very hard when you've got a brand new patient to know exactly what the best goals are. So maybe assessment period, then you have a look. What actually can we work on?
So can I ask, this sheet here, which has got everything on,
Yeah.
you do that at the beginning, once you've worked out what the 3 goals are,
Yeah.
you've got all the possibilities.
Yes, you must fill in all of those ones at the beginning. So again, as I said, my feeling is have a little assessment period and then decide before when you go in, because otherwise you might be barking up the wrong tree. I mean, often that happens, isn't it? In drama therapy, you might be told this person's like this, and when they come to your session, what you're seeing is something else, and it can be measured. So you might want to change your goal, change the goalposts, move the goalposts.
And you know, you said about you might agree these goals with your client.
Yeah.
Do you agree all this with your client, or you do that separately yourself?
Tends to just be this, because otherwise it gets a bit wordy.
Yeah.
I mean, I think, you know, so the guys I work with would just switch off really. They don't really have interest in that particularly. But they quite like the idea. Yes, the reason I want to come to drama therapy is because I'd like to do this. Sometimes, if I'm honest, and there's somebody who's quite tricky to work with, I might have their goals in mind and maybe have a couple of other ones, which I'd share with them later, actually. But at the beginning, for example, we had, when we were talking about emotions with somebody, he was quite suspicious. You know, what are you, no, I don't want to come to drama therapy, what are you talking about? As if we were trying to sort of expose him in some way. And this is all to do with his mental health, etc. So what I didn't want to do is put him off coming, because actually he's great in the group and gets a lot from the group. So we kind of tempered it a bit. You know, I mean, what part of my contract at the beginning is, you can't get it wrong in drama therapy, because if you're doing it differently, it's just you're being imaginative and creative. So, you know, don't worry about getting it right. So this maybe jars against that a little bit. But what I hope it does is, it's not really saying +1 is better than -1. Really, it's not. It's just saying this is what happened on this session, on this day. Because actually, a +1, if someone gets +1 all the way through, your goal was wrong to start with, really. It's not what they've done. You underestimated what they could do. So you're aiming to get a kind of 0 at the end. When we set the goals at the beginning, I have to say, we don't discuss them in the group, because actually it's in a group and everyone's got different goals, and we keep it private between, you know, we see someone individually before they start. When they come to the group, if they volunteer that, oh yeah, I'm working on that, but actually no one ever has. And I think it's very much in the background. As facilitators, so that we can measure properly, we need to have in our mind, actually this is what this person's working on at the moment, so that we can measure. But it's not actually, we don't talk about it particularly. It's not considered terribly important, I don't think, and we just get on with what we'd normally do in the session. Let's just go on to the next thing. Now, when I talk about T-scores, that's when it really might start to make your brain hurt. If we just go on to the next one. And just show you, this is, we didn't do it in blue. Basically, we have a table that I've made. Again, this is not in this book, but this is how we do it, is. So, just shift over. Date of session. Did they attend? Yes. If they didn't attend, why didn't they come? Goal number 1. Able to maintain focus during the mindfulness exercise with prompting from facilitators. Scored 0, because that's what we said as 0, is able to focus on some of the activities with prompting from facilitators. Exercise 2, I'm referring to what exercise we were using. So if someone's looking at that and thinking mindfulness, what are they actually doing? Exercise 2, they can have a look and see what we've done. Goal number 2, X offered to share his image with the group without prompting from the facilitators. Exercise 5 and 6. Okay, so I'm referring back to my glossary, which you don't have to do, but again, I think it makes for a fuller, when you give it in to somebody to look at and you're not there to explain it, they can see what's going on. So that's a +1, because I think I've said that you could only do it with prompting from the facilitators. That's what I thought, but actually they did it without. They got a +1 there. Goal number 3, X demonstrated he could recognise 3 different emotions in the exercises 3, 4 and 10. So it's maybe something, if they're doing an enactment or something, or we notice, how do we think the king feels? Oh, well, the king feels sad, so that's one emotion that's been noticed. Or this has come up. It may be that you don't measure everything in every group. That's the one difficulty. You might think, well, actually, I was really working on emotions this week, so of course it was easy for them to identify some. But other times we might not name them so much. But generally, something like someone's feelings, it does tend to come up in drama therapy. It does in my sessions. So the emotions one has worked, but I don't know if maybe people work differently. You need to find one that would work for you for your sessions. At the end, so there's a 0, because that was what we'd said, +1, slightly better than expected. That was a 0, because that was what we expected. 0 + 1 + 0 equals +1. And then you look it up in the chart, and I'll show you that in a sec. We probably need a cup of tea by the time I've done this bit. Sorry, just go back a bit. Over here. Oh, I haven't put that in. No session. No session staff in bed. I don't know. Staff training or something. Sometimes you're going to miss the session, or something's going to happen, or people are going to get sick. And I unfortunately had in one block of sessions, I got a bug. And then next week she got a bug, and it's all, it's on the gas. Lorna's sick, then Rowanna's sick. And then actually it's quite interesting because you can see what happens. How are people affected the week after that? They were expecting drama therapy and you weren't there. This wasn't a planned break. It can affect, you can really see how the break, unplanned break, may affect their goals. And that's something you can obviously bring up and talk about and name in the room. I thought you were coming, you didn't turn up. What does that happen? The next time they see you, it may affect, and I'll show you, hang on. So it didn't come, was in bed. This is a real forensic one. So no, they didn't come because their reason for not attending because they were in bed. Now, they may be they were unwell, but it may be, or something's happened, they've shut the door, they're not sleeping well at night because voices or something's happening at that time in their life. So I find it useful to note that. Again, this is something that I've put together, really, because then at the end, you get your T-score. I really only ever use this one, okay? Maybe I could just put that in an email to people. What it says is the sum of your scores. So if you remember from the last one, it was +1. I'm going to do it in the book. So if it's +1 for that group, you can go across and you'll see, you can't really read it there. 50 is 0, right in the middle of that. Means if you're scoring around 50, that you're meeting the goals that you've aimed to. This is slightly over, I think it's 54.56. You see it's, yeah. Oh, that was slightly better, something happened there. So slightly over, +1. So what you're hoping is, at the end, when you're looking at all of them, that they're all around 50. I kind of say 45 to 55.
I'm really not
Lots.
good with numbers.
No.
And I'm wondering how 0 can be 50. And
Okay.
maybe I've just completely
Yeah.
misunderstood something.
No, I think that's a very good question. It just is, it's a teaser, it is a mathematical thing. I've got to be honest, I don't quite understand it. My husband said, oh yes, the T-score, and seemed to know what it is. 50, I suppose thinking if you were measuring out of 150s in the middle, 0 is what you're aiming for, because you've got a planned goal. You don't have to do it. You could say, if you like, he got mainly 0s. However, if you really want a precise thing, when it's the difference between very slightly one or the other, you are more likely to get it. If you, particularly on a brief intervention, you're more likely to get an accurate score using the T-score. What I quite like about the graph, a visual thing, you can see the ups and downs. Now, I happen to know that something in particular happened there, and there was a fire setting incident on the wards with this person. So we could see how this affected, I can't remember if it was before or after, but I knew at the time when I was evaluating. So we can see these things. Gas here showing, that's an example. He scored, I mean, I picked this one because he scored 50. In the middle, but there were some ups and downs. We're allowing for these fluctuations, but overall, the treatment, as far as gas is concerned, has done exactly what it says on the tin. We said we were going to do this, and we have delivered this. Yeah. Quite interesting, some of them. This is quite fascinated by, on a very even keel, and actually was going to leave at the end. So maybe I think, feeling what's going to happen before they're able to leave. On a yes, right dead on that line there. Again, and again, you can look. I like visual things, so I like to have a graph. I have to be shown how to do them, but they're very easy on Excel if you've got the right program, and you may know how to do that. If not, ask a teenager or something. So in that case, yeah, and that will give you an average, you see, at the end as well. So overall, so I've rounded it up to 49 bits. 45. And sometimes they're not, it's quite funny, sometimes they're higher or lower than you might expect, actually.
Do you ever take out outliers, like the highest and the lowest score, in order to get more, like, for example, if somebody was just like, I don't know, had a psychotic episode in the middle of the session, and obviously their score would be like really...
Well, it depends what you're measuring,
well,
but
it
yeah.
depends what you're measuring.
Yeah.
Well, I just remember, this is like ages, like 10 years ago or something, I was doing statistics and research methodology as part of my psychology degree, and we did all this stuff, and I could have told you what his T-score was, but I can't remember now. But anyway, yeah, if something was like a major outlier, they would just take out like the two main ones that would throw off the score, because otherwise the score in itself isn't valid anymore.
Yeah.
It's just reflecting, like for example, someone could score like 50 throughout, and let's say one session they got 100, that would make the final score something like 75.
Yes.
And it doesn't reflect what happened, actually.
Or what you do is you write, I mean, I would never just say that's, oh, there's my evaluation of this patient. I mean, you know, this is a little extra thing. I still write the reports, I still put the case studies in, I still, you know,
you get a
make
sense
films.
of the journey, though,
You do, and you could with a group, and I couldn't quite manage to do it, I'm afraid for this, but what I was going to do is put our whole group on with all of them, and then see, oh, do they peak at the same time, some of them are on the same ward, or what's going on?
Yeah.
Are there other things going on that might affect what happens in a session? Again, it's an unplanned break. When they come back next week, what happens? Or after a break, or first session, how do things change? I can't remember what's on the next thing. So just do a quick flip. Okay. This will really make it. What I would like to do, and anybody who works with schizophrenia, this is sort of this is what I'd like to do in the future. the nice document from 2009. It says that, actually, it says, yes, at present the data for the effectiveness of arts therapies on either outcomes such as social function and quality of life is still very limited. But, hang on, despite this small emerging evidence base, recognise that at present art therapies are the only interventions, both psychological and pharmacological, to demonstrate consistent efficacy in the reduction of negative symptoms, hurrah, of schizophrenia. So, 2009, we can say hurrah, but actually there are no dramatherapists, RCTs, that were involved in this. It was art therapy, music therapy and dance movement therapy. So, where are all the dramatherapy ones? We need to pull our fingers out, because actually, nice guidelines with cutbacks. I'm about to go on a rant, you can tell it. With cutbacks, if we haven't got any evidence, they will just cut us. They are cutting people left, right and centre. Absolutely. Because if you can't prove that you're doing what you're setting out to do, they're going to think you're either hiding something, or the commissioners don't care about golden moments. They don't care. They don't need to care about these things. We need to care about them. But if you can show them a pretty chart and say, I've got this goal and this is what we did, and you know, and also show that you shared it with a team, sometimes working together, it gives you a lot more clout. Still write your case studies and still make films, etc. What's interesting is also in this, it's not just that arts therapies are effective in reducing negative symptoms, but it's the only thing that apparently, if you check 6 months later, it's retained. There we are. And that it's literally the only treatment. This is our USP, unique selling points, that actually, you know, that actually the effects of treatment will stay with somebody. Well, they've been proven to stay with people who've got schizophrenia. But maybe the other ones are just trials waiting to happen, actually, so in education. Obviously, these are applicable to schizophrenia, but if you're in education, you may have things that you can connect to. I worked in a prison, it's an education department, and I had the LOs, the learning outcomes, which used to just drive me bonkers. But actually, you could fit in your goals around those kind of things that, you know, are user-friendly to the rest of the service, so that we're included and not excluded, as we often are, or considered the weirds, yes, arts therapists in the corner. So, you know, do pick your wording and things that can fit in a bit, so fit with your patient, your client, but also fit with your service, things that you know that they're maybe aiming towards. Okay, I think that's probably plenty, isn't it? Please have a look and try it out, because you will find, yeah, you can. It is easier than I've probably made it sound, actually. Should we have tea? Yeah, and then do some questions and things. And
Take to past?
Yeah, brilliant.
So it's a way to sort of some kind of and of course it will depend a lot on how
Is he on the case?